Hospitalizations are up 7,379. That's an increase of 87 over yesterday. And when it comes to the number of people who have passed away, the number right now is 2,735, an increase of 31 reported in the last 24 hours. Jeff Reddick is at the State House waiting to talk with the governor, and he joins us right now. And Jeff, any inkling as to what he may be talking about today?
No, we know that there's going to be more focus on testing. That's one of the main things that we're looking to hear about today, per the spokesman in the governor's office. We also know that we're kind of looking at these trend numbers, and before today they had been up. New cases per day had spiked around 700 or above 700 twice over the past few days. We're just looking at this new numbers now that came out, 590 new cases today. That's down quite a bit from some previous numbers. So we'll be interested to see what he says about whether or not this represents any kind of spike or just more testing.
All right, Jeff, let's find out right now. Here's the governor. He's at the podium.
Well, good afternoon, everyone. Today I'm wearing a tie from John Carroll University, University Heights near Cleveland. Notable alums, the late Tim Russell, Cincinnati Mayor John Cranley, Michelle Gilchrist, her husband Chris. Michelle is my district representative for many, many years, an attorney, district rep in Northeast Ohio, and does an absolutely fantastic job. And my dear friend Alberto Fidel is also a graduate of John Carroll, one of the 2020 recipients of the Alumni Medal from John Carroll. For our economy to grow, for us to get people back to work, it is imperative that we not see significant spikes in the coronavirus. We have to keep it as much as possible under control. Public confidence is so very, very important to growing our economy. And when people are not confident, they're scared about the virus, if they see a spike in the virus, that is not only bad from the point of view of the individuals and their health, but it's also certainly not good for the economy. To accomplish this, as we've talked a lot about, we have to do two things. We have to test more, and we are testing, and we're doing tracing. Testing is going up, and it's going to continue to go up in Ohio. And we have to encourage people to be tested. And that is something that's very, very important as we move forward. And as I said, our numbers are going up, and we've removed the restrictions. If you remember when we started through this, it was a limited number of people who could get the test. Today we have more tests, and we're expanding that capacity every single day. So more testing is important. The second thing we have to do is stay focused. All Ohioans have to continue to do the distancing, not really social distancing, but just physical distancing. In public, go to a grocery store, go out, we get more and more of us to wear masks. That's going to make a huge difference. Wash hands, all the other things that we talk about. So those are really the two things. We're going to have more testing opportunities. As the slide shows, Eric will get that slide up here. There it is, and you can see some of the locations that are coming up this week. June 23rd, 24th, Columbus, 23rd through the 25th in Cincinnati, and then you see Portsmouth, Xenia, Morgan County, Dayton, Lancaster, Columbus, and there's going to be more and more of these that are coming. And so we really want to encourage people to go out and get tested. So because the restrictions have been changed and now anybody can get a test, Fran and I thought, and John thought, this might be a good day to be tested. So that's what we're going to do. We have three members of the Ohio National Guard I guess I get to go first, right?
Yes, sir.
Okay, tell me what are you wearing there? What's going
We
on?
have a face shield right here just to protect me in case you sneeze or cough during the test. We have a gown, gloves, and our N95s.
Okay, looks like you're set.
We are set. Are you
Okay.
set?
What are we doing? Tell me how we do
We're
this.
going to take a Q-tip, we're going to put it in your nose and swab around for 10 seconds on each side.
Let's go. Let's do
All
it.
right. Okay, we'll start on the left side. And then the other side, you ready?
Sure.
And that is it.
Okay, that's it?
That's it.
All right. Awesome.
Thank you.
Fran is next. So you've been doing these nursing homes.
Yes, nursing homes, any state facilities where there's large amounts of people living and congregating in the same areas.
And the patrol now, of course, is going out and doing some general public. People come in, so
Yes, sir.
we showed some locations up there on the slide a minute
Yes,
ago. So.
correct. All right.
And so when someone comes here, let's say they show up in Xenia this week.
Yes,
You know, Fran and I filled out a form. Just fill a form out, not very complicated.
correct.
And then,
You get your test, and then we take all of our specimens to a lab that's designated based on the region. And then those tests are ran, and you get results within 24 to 48 hours.
okay, all right.
All right, Mrs. DeWine, you ready? 10 seconds on each side. Okay, then breathe in to the other side. Perfect, all done.
All right. Now we get the athlete. We'll see how the athlete does here.
So you two look like you were enjoying it a lot.
They didn't do too shabby, did they? Alrighty, same for you, Lieutenant Governor. Each side will do 10 seconds. I'll let you have a breather in between. Sometimes it might make you sneeze or cough.
All right. I certainly wouldn't want to be your worst patient. So.
Okay, you ready?
Yeah.
Other side.
All
You
right.
ready?
Yeah.
All done.
All right. There we go.
Well, thank you very much.
It was
Thank
much
you,
better than
sir.
advertised.
We appreciate the good work the Guard does, so
Thank you, sir.
we're very, very grateful. So,
Thank you.
so in real life, your job is?
I'm a civilian RN at
nurse.
Riverside Hospital,
Yeah,
nurse.
good.
I'm currently a student for nursing at Wright State.
Great. Right state, our home county, so yeah,
Yes, sir.
very good. Thank you.
Thank you,
We
sir.
appreciate it very, very much. So let's look at those sites one more time. And this is what is coming up. We would encourage all of you to go out and get a test. And this will certainly help us as we get as aggressive as we can get against this virus. So those are things that are very, very, very important. The second part, of course, is what we all do, what each of the 11.7 million or so Ohioans do each and every day. And we're starting this week 3 ads on television that are focused on what role each one of us really plays. in determining how well we can battle this virus. They talk really about how our economic recovery is tied to how well we are battling the virus. First ad is titled, I Believe. 15-second ad. There's actually two of these, two 15-second ads. They are starting to run today, so you may see them on TV. They're also on social media. Two of our fellow Ohioans you'll see in these ads.
Some people say masks don't make a difference. Fact is, if 4 out of 5 of us wore a mask in public, the spread of COVID-19 could be significantly reduced. That's what I believe.
People think we can ease up on social distancing. Fact is, your chance of getting sick is still linked to the distance between you and an infected person. That's what I believe.
So two of our fellow Ohioans, I want to thank Dr. Kevin Sherritt of Greene County, Dr. Hog Farmer, and also the Greene County Coroner. We also want to thank Sharice Mashika, a nurse manager at Mercy Health, St. Elizabeth Youngstown Hospital. We want to thank both of these health professionals for what they do each and every day and for giving us that message. These spots are paid for by the Ohio Department of Health. They'll be airing across the state for 3 weeks on broadcast, on cable TV, and social media. I will now turn to the third ad. The next spot is called Up to All of Us. Again, features several of our fellow Ohioans. And Eric, we'll take a look at that one.
With Ohio opening up, we need to be smart. When we shop or dine or work, please do it safely. Wash your hands, practice social distancing, and wear a mask in public.
That way, businesses can stay open and don't close again, and our economy can recover and jobs can come back.
Together, we'll protect our families and our friends.
And help our economy grow. Ohio's future is bright.
And it's up to all of us.
Ohio's future is bright, and it is up to all of us. I think these are two optimistic ads. We can do this, Ohioans, as we move forward. I want to thank Dr. Laura S.B. Bell, who's an Ohio Health Emergency Medicine physician, and Gary Calicote, an Ohio restaurant owner, operator, for being part of this effort. The Ohio Bureau of Workers' Compensation paid for this as part of the agency's ongoing mission of protecting Ohio's workforce. This spot will begin airing at the end of the week and will also run for 3 weeks across the state on television and social media. The message in this public awareness effort, I think, is really clear. We must keep taking appropriate precautions to keep this virus at bay. We're all seeing numbers. We're in a pretty good shape in Ohio, but we are seeing some uptick in a couple parts of the state, and we're going to continue to monitor those. But how well we do depends on how well all of us do each and every day. When we go to work, to shop, to dine, go out, it's critical that we continue following the lessons that we've been talking about really from the beginning. Wear a mask, keep the social distancing, wash your hands. These precautions protect each and every one of us and fight back against this virus. We'll take now a look, we'll look at the daily numbers real quickly. And again, the things that we look at, these are just some of the things that we look at, and I won't go because of time today. On Thursday, we'll look at some other more detailed numbers. But these are the kind of the general numbers. As you can see, if you look at the cases, our cases are up. They're down a little bit from where they were a day or so ago. But the 21-day average is 466. We are up at 590. So we do not like to see that. We're going to watch it. And again, what's really important is we kind of drill down and look at it by county and look at it even down into the zip code. And we'll go into that more in detail on Thursday. Our deaths, last 24 hours reported 31. The average has been 23. Last 24 report hours, hospitalizations is up as well. And ICU admissions is up as well. So we will watch all those numbers and continue to report on them. I want to talk for a moment about the vandalism that occurred a few days ago at the State House. This was vandalism on the outside of the State House. In discussions with the Ohio State Highway Patrol, it's clear to me that they did not have enough people, not enough troopers who were there at that moment, at that time when that occurred. I have talked to the colonel, and I've talked to members of the Highway Patrol, and they assure me that this will not happen again. They will have enough people there, and this damage will not take place in the future. This is damage that we should not tolerate, we will not tolerate, and we will be able to protect the State House. Let me just talk for a moment about the demonstrations, the protests, and the relatively small number of people who are committed to violence. Again, the vast majority, as I've talked to the different mayors, the vast majority of people who are demonstrating are demonstrating. They're protesting. They have every right under our Constitution to do that. But they're clearly, in Columbus, for example, maybe 150, 200 of people who clearly are there for violence, and that violence will not be tolerated. This is something that there is a line, you cross that line. Demonstrations are positive things. People have every right to do that. But when we reach the point when we have violence, that is simply not to be tolerated. Look, we have seen businesses vandalized. We don't know every story of every businessman, woman, but many of them are small businesses. They've worked a lifetime. They've worked many, many years. They've invested. They sweat. And to see that wiped away in an act of violence, act of vandalism, act of destruction is just a very, very sad thing to see. So just some comments about that. I checked again with the patrol, asked them how their investigation is going. I've also talked to the mayor this morning of Columbus as well. And what the patrol has told me that their investigation continues. My instructions to them is that when there is vandalism, when there is any act that's illegal, they are to investigate it, and they are to take that once they get the case and to take that prosecution, and we are going to seek prosecution in any case that we have. Let me also say to the protesters, all the protesters, some of you were wearing masks, some were not. We would just ask you again, we are all, as a people in the state, all in this together. And what your actions do impact other people. So wear a mask. Keep social distancing. These are things that are very, very important. You can protest, get your point across, but it's imperative for everyone to keep the social distance, for everyone to do everything you can to slow down the spread of this virus. And we would ask you to do that. We're now going to move to talk to Dr. Sarah Bodie. Last week we talked about how important it is for individuals to continue to receive necessary and needed medical care despite the pandemic. And there's been a concern raised about people neglecting their health, not catching up with what they should be doing during this period of time. What we've seen is there's been a significant reduction in the number of well-child visits for Ohio's children over the past few months. It's more important than ever to keep these appointments and to ensure kids that get their preventive care. So Dr. Bodie, who is a primary care pediatrician and the medical director of Nationwide Children's Hospital's Care Connections School-Based Health and Mobile Clinics. Thank you, Doctor, for being with us. That's a long title, Doctor. I almost didn't get through that, but thank you very, very much for taking care of children. And maybe you could just kind of tell us what you're seeing out there as far as with the public, people bringing their kids in, and what you would like to see.
Absolutely. Thank you, Governor DeWine, for inviting me to speak today about the topic of pediatric vaccines. What we know, as you mentioned, is that during this time of COVID-19, we've seen a very sharp decline since March in the number of kids that have come in for vaccinations across the state. In Ohio, the rates have been down about 45% from what they typically see this time in previous years. And we've seen that same trend locally across our nationwide children's primary care network, which includes over 15 clinical sites that care for vulnerable children in Franklin County. We've had a drop of over 8,000 vaccines per month over the months of March and in April. Additionally, when we think about the measles vaccine, we typically vaccinate over 1,000 children a month with that particular vaccine. And in the month of April, as an example, that number was 32. Why does this concern us? Vaccines are critical to prevent disease and outbreaks. We know this through recent outbreaks of measles, mumps, and chickenpox. Those are reminders at how important this is for children. And what we want you to know is that pediatric offices are open and they're safe. Offices have worked hard under the pandemic to open in a safe way and take extra precautions and measures, from wearing appropriate PPE to spacing out well-child appointments and allowing parents to feel confident when they come in that they can get their child seen for their well check and their vaccines and do that in a safe manner. But what we also know is that that's not enough. There's a large gap as new children age into needing these vaccines, and we are trying to catch up from the children that have not had them in the previous months. We need to start thinking creatively about how we're going to help catch up and close this gap. In large part to the student success and wellness funds that were focused in your budget, we've seen an increase in the number of state school health partnerships. These are exactly the kind of relationships that can allow for this creative thinking on how we can help connect children to these important checkups and vaccines. So we're working locally here, and I know in other parts of the state as well, to work with several schools alongside local health departments to really provide some additional opportunities. So we have vaccine clinics that are going to be operating all summer long, again, in a safe manner for families, so that they can come and get their children caught up prior to the start of summer, end of summer, and start of school, where as children get back to school, we worry about there being a potential outbreak.
And Doctor, you talk about those clinics. Where are those available? I mean, where can someone find out where they are?
Yeah, absolutely. So actually within Nationwide Children's Hospital on our school health website, we have a list of locations, and we're going to be printing flyers that we'll distribute to many of our community sites. Additionally, Columbus City School District is going to be advertising those on their website as well, and we're going to be in several area schools across the county.
Great. Doctor, thank you very, very much. Thanks for what you do every day to take care of young people, and thanks for kind of giving us that warning. Those numbers, Doctor, are really kind of staggering as far as the drop. And I guess the goal is in the next few months to start picking that back up.
Yeah, we have a lot of work to do, but I think we're going to get there.
Okay, good. Thanks, Doctor. We appreciate it. Thank you very much.
Thank you.
Thank you. Lieutenant Governor.
Thank you very much, Governor. Great to join you again today. The theme of my brief remarks are built around freedom and mutual respect. We have received a lot of questions through social media and through the office about 4th of July celebrations, and also want to touch briefly on the protests and the activities that the governor discussed. We're in that season where we're headed towards Independence Day, and people want to exercise their freedoms, and we want them to do so with mutual respect. The First Amendment does give us the right to peaceably assemble, and I emphasize that word, peaceably. The protest, we want them to be heard about conditions and policies and injustices, but we also need to respect each other while we're listening to one another. And the defacing and the destroying of both the private and the public property is not a right. Disrupting businesses and traffic is not a right. And doesn't respect your fellow citizens. All of us can either escalate or de-escalate a situation with our words and our actions, and I think that's what we're encouraging, more peacemakers as we go through this process. And as we move towards Independence Day, that theme of mutual respect, we need to make sure that it's observed. We get a lot of questions about fireworks, and we want to provide some of that clarification today. We know that there will be many celebrations across Ohio, and we've received some questions about them. The large gathering order is still in place. Large gatherings are highly discouraged and not allowed. And a lot of the fireworks shows have already been canceled. But some of them will proceed. We know that some are still going to be holding these events. We just ask you to do so safely. And that requires all of us, not just the local government or the community that may be sponsoring it. It requires all of us in our actions. Fireworks shows are not prohibited. They can proceed, but what we're encouraging is, or what we're not encouraging is the large gatherings. There are ways that we can celebrate without gathering too closely together. It's the same common sense guidance that we've provided all the way through, that you've been hearing for months: the distancing, the disinfecting, the masks, and small groups. So we encourage you to celebrate safely during this approaching Independence Day holiday and practice that social distancing the entire time, because you can still celebrate. You can just watch from your porch or your car or a backyard or someplace where you don't have to be close to people that you don't normally associate with. That's the mutual respect for each other. It's that balance between freedom and responsibility, and Ohioans have done so great so far. That's why our numbers continue to be solid. We continue in many cases to do the right things, to see success in this state, and it's because of your actions. And I know that as we exercise our freedom in the coming days and weeks, that we'll get this right too. So thank you. Governor?
Lieutenant Governor, thank you very much. We'll open it now for questions.
Hi, Governor. Andy Chow with Ohio Public Radio and Television State House News Bureau. Just wondering, with the encouragement of increased testing and trying to ramp up the number of testing around Ohio, have you given any more thought into looking into better data as to kind of talk about that testing, especially when it comes to maybe putting out a positivity rate, adding more data to the website to talk about and give a clearer picture about the higher number of tests?
Yeah, Andy, I thought the positivity numbers were up, and if they're not up, I'm seeing them, and if you're not seeing them, we will fix that. We're trying to drill down more and more on data. So my commitment to you is, when I leave here today, I'll go see exactly what we're putting up. I'll compare that with what I'm seeing, and we'll try to share more data. I mean, the numbers I looked at this morning showed that the positivity number was holding about 4%, and that's pretty decent. And look, we're increasing testing. I think if you look at the last 4 or 5 days, last week, we're probably averaging around, I don't know, somewhere around 14,000. You know, we were down at 10. We were before that at 8. So we're going to continue to move forward on that. We have some other ways that we're going to try to expand testing that's in the works. We're not ready to announce yet. I know some people have said, look, when you increase testing, you're going to automatically see, more cases. Well, yeah, it's going to increase cases some. What we have to continue to watch is exactly what you said, the positivity number, and we kind of see where that number is. I was on a phone call yesterday with the governor's. Call was organized by the vice president along with the Governors Association. And I know governors from a number of states were telling us that they were seeing an increase in positive outcomes among younger people in their 20s, 30s. And we are seeing that. I will share those numbers with you on Thursday. But we're seeing that in Ohio as well. Now, maybe that's more people being tested. Maybe it's more that age group is being tested. But it's probably also that we got young people who are moving around a lot. But we'll certainly share any data that that we have with you.
Hi, Governor. This is Molly Martinez with Spectrum News. These protests have obviously been very emotional and very tense for both sides, but it seems that there is a disconnect as to who exactly is inciting violence. Mayor Andrew Ginther said that he would stop the practice of using pepper spray on civilians, but as we saw last night, law enforcement was using pepper spray pretty liberally. I'm just wondering, I want an update of how many police forces have subscribed to these voluntary minimum standards, and also a lot of these officers aren't wearing body cameras. Can you talk a little bit about the accountability of what is said and then what is done?
Well, Molly, as you know, under Ohio law, the governor's in charge of the National Guard. When we've been requested to bring in the National Guard, we have done so, and we'll continue to do that. We have also, and we've done that we've done that in Cleveland. Excuse me, we've done that in Cleveland. We've done it in Columbus. We've also, in more communities than that, many more, been requested to bring in the Highway Patrol and to have them be of help. But the police department, of course, are directly under mayors, and they're directly under the cities, and the cities are the ones who make those determinations. I think in our last press conference, the one before that, I outlined, what my aspirations would be. My aspirations would be that every officer in the state would have body camera on. We know that's not true today. My aspiration would be, and what we're going to work with the General Assembly, that we would have a uniform use of force policy statewide. So, and many other things that I have outlined. But I will say that when the police are dealing with demonstrations, and when you do have some people who are there under the guise of protesting who want to wreak havoc, who are not interested in getting their message across, but in fact get in the way of getting the message, people who are looking towards violence, people are looking towards doing other unlawful things, it is very difficult for police. It is very difficult for chiefs of police. It is very difficult for mayors. These are not easy decisions, and the decisions have to be made sometimes in a very, very tough and difficult environment as the police, as the officials, including the mayor, make a decision about how do I allow protests to continue, how do I protect protesters, but at the same time not allow businesses to be destroyed, lives to be messed with and hurt. So these are not easy. And, we can all go back and play the video, and we can all second guess, but the people who are making those decisions, from mayors to chiefs of police to the police themselves, these are not easy. These are not easy situations to be in.
Hi, Governor. Jim Oddie from WHIO-TV. How you going? I want to ask on another topic. Earlier today, you had endorsed Wright-Patterson Air Force Base in the Dayton area to be the home of the new U.S. Space Command headquarters. I want to have you talk about that. You called it the ideal location. Could you expand on your hope to land that new mission at the base? And then, realistically, what are the odds of getting that mission and the 1,400 jobs that come with it?
Well, Jim, we want it here. We think it should be here. We have seen Wright-Patterson continue to grow. It is the brains of the Air Force. We have so many people who are doing such great things at Wright-Pat that we think it's a logical place for this Space Command Center to be. We know there are a lot of people competing, a lot of cities, a lot of areas, a lot of states that are competing, and we understand that. But we think we've got a good story to tell. We know we have a good story to tell. And this is something that, we're working very closely with the Chamber in Dayton and with other officials in Dayton at the base. And we think it's very, very important. John, do you have anything to add to that?
Look, I really believe that we got a shot at this because of a lot of reasons, both in terms of the research and the talent that already exists at Wright-Patterson Air Force Base, the Air Force's leadership in this space already. We got a great cost of living there. It's a lower cost of living to run the command out of Ohio than it is out of some of the other places we're competing with. So you have the talent, you've got the right kind of environment. It's already a source where a lot of this research goes on. We have, NASA Glenn right up the road in Cleveland. There is every reason that if they're going to assign it somewhere, that Wright-Patterson would be the place to locate it.
Good afternoon, Governor. It's Laura Bischoff, Dayton Daily News. Lieutenant Governor Husted just talked about fireworks. There's two bills pending in the legislature, one that cleared the House already, but each of them would allow fireworks, amateurs to, fire off firecrackers, Roman candles, bottle rockets 24/7, 365 days a year, unless there's local regulation. I know that you're a big supporter of local control, but you're also very concerned about children's safety and health. What's your position on these bills? Would you sign them if they reach your desk?
Well, Laura, look, I understand the concern that people have that our law today is not enforced. But I think also that I'm going to side with the Children's Hospital folks and the safety folks who can pretty much guarantee us that we're going to see more people go into the emergency rooms, and we're going to see kids end up going to the emergency rooms if this passes. So I'm not in favor of this bill, and that shouldn't shock anybody who knows me very well.
Thanks.
Good afternoon, Governor. Jeff Reddick with ABC 6 News here in Columbus. Just yesterday, we learned of Vice President Mike Pence's visit to Lordstown, scheduled for Thursday. Today, we learned you plan to visit there Wednesday, and does not appear you will go on Thursday. And why is that the case?
Well, I think this is a big day for the Mahoning Valley. It's a project that we have been very much interested in, very much supported. Jobs Ohio has been involved. Our administration has been very much involved. I want to support that. I want to support the people of the Mahoning Valley. Fran and I will be there tomorrow. We're going to take a tour. We're going to have an opportunity to see exactly what's going on. But quite candidly, throughout this pandemic, We have, Fran and I have avoided crowds. We have not gone out to, to be close with a lot of people. So we're not going to do that. Vice President's going to be there. I just want to tell you, as I've told him, that I think he's been stellar throughout this. If you could be on the calls and just listen to the exchange between governors and the Vice President and the people from the White House and the medical people, I take a page, at least a page or two of notes every time we do those conferences, and I always learn things, and it's always very, very helpful. So I'm sorry I'm going to miss the Vice President. I'm sorry I'm not going to be there on Thursday, but Fran, I think this is the best thing to do.
Would that be read as a rebuke of the White House's standards on gatherings, large gatherings?
Wouldn't be a rebuke of anything. It's a compliment to the Vice President and to the Trump-Pence administration for the work they've done and be in cooperation with governors. And I'm sorry I'm going to miss the Vice President when he's there tomorrow. He's a good man.
Thank you.
Hello, Governor. Ben Schwartz with WCPO in Cincinnati. Governor, I want to ask a question sent in from a viewer. This particular viewer has a 98-year-old mother in a nursing home who he now hasn't seen in around 3 months. He wants to know if there's any progress being made towards allowing Ohioans to visit nursing homes. In his own words, the elderly don't have a lobbying group like Kings Island to help make demands. So the question really is just, is there any progress being made towards that, maybe an advisory group or something along those lines?
Yeah, Ben, there's nothing that has been, to me, tougher or more heartbreaking to see than families who have not been able to visit their loved ones who have not been able to receive visits by their family members. People who, as she said, they may not have lobbyists, but they certainly have sent me letters. They certainly have sent me emails and texts. So I get it. We have tried to balance the safety of everyone in that nursing home with the real need for people, particularly after 3-4 months, to see their loved ones in person. And we know that 70% of the people we've lost in this have been in nursing homes, congregate care settings. So we know how fast it spreads. We're ramping up that testing as we can now in the nursing homes. We'll be having more announcements of things that we're doing. The GARD is going strong. I've asked Rochelle McElroy, who heads up our aging department. She had been working very, very hard, among all the other things she does, on exactly this issue and try to find the right balance so we can protect people, but at the same time answer this real need that is out there. And so we've already started with assisted living. Those are now moving forward, and we should have something to announce within the next week about our plan so that people can start visiting in nursing homes. We're going to be very careful. As we can test more and we have more testing availability, that is going to help us do that. So I hear people. I don't have anyone I don't have a parent in the nursing home now. My parents are both deceased. But if I had someone in there, I can only imagine. We have a friend. I have several friends. We have one friend, our friend Fred, and we're going to go visit him in the next few days because that is now available in assisted living. And the place that where Fred is just now opened up to be able to do that. And you can get an appointment and you can sit outside and talk for a period of time. So we're going to do that. So we will have a plan out, within the next week.
This is Jackie Borchert from the Cincinnati Enquirer. I believe that the current public health order that limits gatherings to 10 is set to expire next week. Do you plan on expanding that group gathering limitation? Why or why not?
Look, we're still looking at that. We're trying to come up with what the new guidelines should be. Again, everything that we're doing goes back to the distance and keeping people safe. We continue to broaden those as we've opened up virtually everything in society today. We've obviously changed that in regard to what people can do in their own home. So we're going to continue to move out and move forward on that. But I don't have anything specific today to announce what that new order will be. But again, more and more, it's going to be up to what people do. And we, as we saw in the two ads, we're just really encouraging people to. If we're going to get through this, if we're going to continue to be able to live our lives, be safe, but also enjoy some of the things that we like enjoying, we're going to have to continue to do the distancing. We're going to have to continue, we hope more and more people, when they're in public, will wear masks. But we'll have more on that.
Hi, Governor. This is Laura Hancock from Cleveland.com. Thank you for committing to sharing the testing positivity data. Just a plug, can you share it for each day instead of a running total? And if we could have, like, for the last several weeks, what that historically was. My question is about Thursday with Vice President Pence. Do you want him to wear a mask? Have you communicated that to him?
I've not communicated that to the Vice President, no. I made my position pretty clear. And look, the science is pretty clear about wearing masks. And, particularly, depends on how close people are together. But when people are out in public, it's certainly the safest thing to do. But I'm not going to tell the Vice President what to do. But, this is how we all kind of stay safe and help each other.
Hi, Governor. Kevin Landers, WBNS 10 TV. What kind of context will you be providing on Thursday behind the numbers so that we know if it's congregate setting, nursing homes, if people who are testing positive over and over are being added to the cumulative number? And also, can you provide your thoughts about cities like Columbus that are planning on taking down the Christopher Columbus statue? Do you think that's the right thing to do?
Well, Kevin, I guess I would ask you, what specifically do you want? I mean, we've provided a lot of information. We're happy to try to drill this thing down and, get additional information that is available that we can actually pull out. I mean, I think one thing that, we've tried to make clear since the beginning of this is that when we started, this data wasn't really, most of it wasn't ours. It was hospital data, and we had to, work out arrangements with the hospitals to get this data. And they've been open to giving us this data, and we're now looking at a lot more data than we've been able to in the past. And that's certainly very, very important. But if there is specific data that you want, happy to listen, and if we can pull that data out, if that's doable, we'll certainly try to do it.
And then what are your thoughts about the city of Columbus taking down the Christopher Columbus statue? What are your thoughts about taking down statues?
Look, I don't. I understand. As someone who had a great grandfather who fought in the Civil War and who was at great great grandfather who was at Libby Prison, prisoner of war. So I don't have any trouble, looking at the Confederate statues coming down across the country. But you know, Columbus, this is namesake of this city, and look, you know, I think it's something that everyone's got to kind of look at. But the idea that we're going to go around and pull every statute down because someone is not perfect, I think is, you know, probably not a good idea. One of the things that, as this discussion about Columbus has surfaced in the last few days, one of the things I've kind of vowed to do is something I've never done before, and that is read a biography of Columbus. You know, so if this kind of discussion, which is an appropriate discussion, I'm not saying these are not appropriate discussions. If these discussions bring us to a more fuller understanding of our history and of the people who's have been part of our history, that's a good thing. And so these type discussions are good. Don't think that I'm probably going to be in favor of taking Columbus's statue down. But, you know, as I said, when I get time, I'm going to plan on reading a biography of Columbus. But these are good debates to have. These are good discussions to have. It gets people to kind of dig back in their history and look. And, you know, when you look at somebody in history, we judge them by our standards today. And so, you know, we all will be judged in 100 years by the standards of people in 100 years. Now, that doesn't mean that we back off from what's right and wrong. Slavery was wrong then. It is wrong now. Prejudice is wrong then. It's wrong now. Racism was wrong then. It's wrong now. So it doesn't mean you don't have standards. But, you know, I think you have to kind of balance. You know, at what point do we stop pulling statutes down? And everybody, I suppose, has a different opinion about that. And that's what's great about this country. Look, we live in a country where we can have these debates. We live in a country where people can say, you know, that general, he was a racist. That general fought insurrection against the United States. We ought to take his statue down. That's fine. People can say things about Columbus. You know, we can talk about all kinds of people. Somebody even told me today that out somewhere in California, they're talking about taking a statue down of Ulysses S. Grant. That kind of irritates me a little bit. But we all can have our opinions, and we all can think about what we want to do and have a debate. That's what that's what we can do in this country.
Thank you, Governor.
Mike Livingston,
if I could add a little statistic here that maybe will help answer both Kevin and Laura's question. The positivity rate has declined since we've increased testing, but it's remained between 4% and 6% since late May. So we're right between 4% and 6% of the positivity rate since late May, and we'll get more data out as we can find better ways to deliver it.
And again, like any piece of data, one day is never going to be the ball game. What you try to look is get an average, you know, and kind of see where that average is going and what the movement is.
Hey, Mike Livingston with Gongwer News Service. Wondering when we're going to see school reopening guidelines, and secondly, the Senate tomorrow is going to have another hearing on a bill. I think in May you had said you would veto, which would limit health orders to 14 days without JCAR approval. Just wondering, since May, have you had any conversation with legislative leaders about that idea and some of your concerns on that?
Sure. I mean, I talk to legislative leaders a lot, so you can be assured that we've discussed things like this. My opinion has not changed. We hope within the next week, we will within the next week be able to issue some guidelines to our schools. And I would say to all our superintendents and principals and teachers, and I've talked to a lot of you in the last few months, and to the parents. You know, I don't think you're going to see a lot of surprises. We live in a state, one of the glories of this state is that we have so many different regions, so many different areas of the state. Over 600 school districts in the state, in addition to, you know, our career centers, et cetera. So what you're going to see is guidelines We're going to kind of lay it out, but you're going to see a great deal of flexibility. And schools are going to make decisions what's best for their kids, what's best for their communities. Each school is different. We can go from the Switzerland School District, which is one of the most spread out and rural districts, to city of Columbus or city of Cleveland, or you can go to many of our suburbs. So we got all kinds of different schools. School where our kids, some of our kids went to school, where some of our grandkids go to school in Cedar Cliff, one of the smallest school districts in the state, from there all the way up to large districts. So I understand, as well as anybody does, the great diversity of this state and the great differences that schools have. So schools are going to have a lot of flexibility. That means communities are going to have the flexibility. The science doesn't change. The virus is still with us. And I trust that the schools are going to do the best they can to protect not only the students, but also to protect the teachers, custodians, people at the front office, anybody who works in that building. That's the goal. So they're going to have a lot of flexibility in how they do that, but the basic science that we've been talking about for the last 4 months has simply not changed. Some things are going to be difficult for schools, and they're going to have to figure out how to do things. The buses are a particular problem. Some schools bus a huge number of their kids, some all their kids, and trying to figure out how you do the social distancing on the bus, but at the same time still run your buses and still get kids to school. So I don't think people are going to find, when we're still working on the final details, but when these guidelines come out, I don't think it's going to be a surprise, or very few surprises in there at all from an educational point of view or from a point of view of health. There's a strong consensus in this state, and very justifiable, and I agree with it, that we need to get back to school. In talking with parents and talking with superintendents and talking with teachers, a big concern that when schools were shut down, we had some kids who were already behind because of many reasons who got further behind. We live in a state where, unfortunately, 1 million of our citizens don't really have good internet or any internet access in their areas. We have kids in cities where there might be the internet service, but kids do not have in their home. So these kids it was much more difficult to try to do this distance learning. So the idea of getting back into school is the right thing to do, but schools are going to need to be flexible because we do not know what the future brings. No one knows what the future brings as far as what this virus is going to do, whether there's a second wave or what happens. So we'll be coming out with that soon, but again, no surprises.
Jack Windsor, WMFD-TV in Mansfield. I am the last question. And Governor, my question is for you. It's long. I'm going to try to get through it quickly. Headlines over the past couple days have reported high numbers of positive cases. After digging into the numbers on the Ohio site and the CSV file, we know that many of those numbers are not representative of current active COVID infections. Those numbers include multiple positive tests for one person. For example, a person who tested positive previously and went into isolation needs to hit a 2 negative test threshold, and that person can have multiple positive tests. Those numbers also include cases that can stretch from January to June and are backfilled. We also know that other states are separating out antibody testing results from reported and active cases, and in states like Colorado, they're making distinctions between people who died with COVID versus people who died from COVID. All of this is context that the public needs to understand when discussing day-to-day causes of deaths and active infections. So with that context, and in light of recent protests where social distancing was not being respected, why would small communities throughout Ohio not be encouraged to celebrate with relatively normal 4th of July celebrations? If people want to wear masks, they can. Why wouldn't a community proceed if there are no active infections, no active hospitalizations, or no deaths?
You know, Jack, when you look at the statistics, we can argue statistics. But there's some things we can't really argue about. Significant number of people have died. People still are dying every day, Jack, from this virus. Those numbers are really not much in dispute. We can see the number of people who are going into hospitals. We can see the number of people who are going to ICU. All these numbers were not available before. We put all these numbers so that you can see those and that the public can see those. So, you know, we can get down and quibble about the numbers. I'll take a look at some of the things that you had to say. But I don't know a health expert in this country who does not think that the virus is still very much here, who does not feel that there are certain steps that every citizen should take to try to protect themselves. So there's some of these things we can argue about, you know, skewing numbers, or we can argue about, you know, someone who has a conspiracy theory, or this stuff never is occurring. But you know, it very much is occurring. And what is important is that we understand, and I'll end today with where we started, bringing this economy back, bringing jobs back is so very, very, very important. The number one thing that will stop us from moving forward is if Ohioans see outbreaks in their communities, and we need to continue to do the minimal things that we've been doing. Things such as wearing a mask in public, only in public, not at home, not in a car, continuing to keep the social distance. These things will make a difference. You know, we are seeing nationwide more numbers, higher numbers with young people as they get out. Young people may not be concerned. You know, if you look at the death rate, it's not high among young people. But again, these are individuals that can spread, and we do see spread. We saw a funeral recently in Ohio where you had dozens and dozens and dozens of people who came, got it at the funeral, tragically, horribly. So this virus is here. Anybody that tells you that this virus is not here is simply not right. So we'll continue to try to put out the best numbers that we can, and continue to share those with the public every single day. We'll see you all. Thank you very much, and we'll see you next week. Thank you very much. We'll see you Thursday. Don't want to forget about Thursday. We'll see you Thursday at 2 o'clock. Thank you very much.
You've been listening to Governor DeWine giving his bi-weekly coronavirus briefing for reporters, mentioning there at the very end that Thursday is the next briefing. Today, let's get you caught up. 46,127 cases in Ohio. That's up from 590 cases Monday. 7,379 hospitalizations. That's up 87 from yesterday. And 2,735 deaths. 31 people dying reported in the past 24 hours. Governor DeWine started the briefing today by being tested live on TV for COVID-19. First Lady Fran DeWine and then Lieutenant Governor John Husted following after him. The governor then encouraged everyone to get tested, that there are more drop-in clinics offering tests to anybody who wants one. He said avoiding a spike in cases is crucial to keeping our economy going. DeWine also said the state is releasing 3 new TV commercials that are focused on what role each one of us plays in determining how well we battle this virus. You'll see them in the next week. The governor also took a moment to talk about the demonstrations at the State House, specifically the vandalism. He said it was clear to him the Highway Patrol didn't have enough troopers there, and the Highway Patrol has assured him that it will not happen again. DeWine also said that he talked to Columbus Mayor Andrew Ginther. The governor said his instructions for protests is that when there is vandalism or any act that's illegal, police are to investigate and to seek prosecution. There have been concerns also that people have been neglecting their health during the pandemic. A doctor from Nationwide Children's Hospital said vaccinations for children are down about 45% compared to this time last year, and Children's is down more than 8,000 vaccinations per month for the last 3 months of this year. The hospital will be offering vaccination clinics in the area in the coming weeks. The lieutenant governor talked about fireworks. He said large gatherings are highly discouraged and a lot of fireworks shows have already been canceled, but some of them will proceed. Fireworks shows are not prohibited in Ohio. Husted said for those who are holding these events, we just ask that you do so safely. The governor said he'll have more on guidelines for reopening schools and visiting people in nursing homes next week. A lot of people asking about that. If you missed any of the news conference, watch it on our website, abc6onyourside.com, and on our YouTube page. Just search for WSYX ABC6. We'll see you at 5.